federal government says if violations of the guidelines continues, it might be forced to review the guidelines in what many fear may lead to a total lockdown to avert the more catastrophic spread of the deadly coronavirus. And the 10 people associated with the Lagos government house have tested positive to the COVID-19. But the governor, Babajide Sanwo-Olu, and his wife test negative 3 times now. Hello everyone and welcome to the program. This is Politics Today live on Channels Television. I'm Sean Wakimbaloye in Lagos. Before we get into tonight's conversation, which predominantly will be assessing the ease of lockdown and the measures put in place by the federal government of Nigeria on how we can keep safe and stop the spread of the coronavirus. Let's tell you quickly about yet another huge sum of money that have been discovered as part of the money stolen under the late former Nigerian dictator and head of state, Sani Abacha. The U.S. Embassy in Nigeria says another $319 million that is about 120 billion naira, is in the United Kingdom and France. This is coming 3 days after Nigeria repatriated $311 million Abacha loot from the U.S. and Jersey. In a statement on Wednesday, the U.S. Embassy revealed that there is a separate $167 million in stolen assets in France and another $152 million in stolen assets in the UK, which is still subject to litigation. Let's now give you a quick update on the war against COVID-19 in Nigeria and how far we've gone. From the government point of view, there are some figures that I've sent, that we're following, and we know for now, from late last night, 195 new cases of COVID-19 were announced late last night, which skipped the total number of confirmed cases in Nigeria well over the 3,000 mark. Now, the cases sits at 3,145 cases. 82 of that is in Lagos, 30 in Kano, 19 in Zamfara State, 18 in Sokoto, 10 in Borno, 9 in the FCT, 8 in Oyo, 5 in Kebbi, 5 in Gombe, 4 in Ogun, 3 in Katsina, 1 in Kaduna State, 1 in Adamawa State, and 534 people so far have been discharged, while the death figures stands at 103. From Lagos, we understand that 10 persons associated with the Lagos State House in Marina have tested positive for COVID-19. The Lagos State Commissioner for Health, Professor Akin Abayomi, revealed this through his Twitter handle earlier today. The information about the state government also saying that the governor, Babajide Sanwo-Olu, and his wife have tested negative 3 times now. Today, the Presidential Task Force against COVID-19 has again warned that it might review the guidelines it gave when it announced the ease of the lockdown in 2 states, that is Lagos, the nation's commercial hub, and the AFCT, and of course Ogun State. The committee is worried that Nigerians are not complying with the guidelines, and the fear is that if that attitude continues, the gains of the past weeks might be defeated. The national coordinator of the Presidential Task Force against COVID-19, Dr. Aliyu, gave that information and that hint, and he gave that warning today. Take a listen to him.
The persistent violation of the guidelines that were released at the beginning of last week. We had a lockdown of Lagos, Ogun, and FCT for 5 weeks in order to slow down the epidemic and enable us to prepare well. The gains of this lockdown could be destroyed if people continue to violate the guidelines that we have set out.
Tonight, we shall be dissecting the issues raised since Monday when the lockdown was eased. How far is it in your area? If you're living in Lagos, Ogun State, and the FCT, the nation's capital, how far do you think you're complying with the lockdown order? Do you have fears? Since Monday, we've had the cases increased over 300 cases since Monday. That is, there has been announced over 300 cases since Monday. And we're dissecting the ease of the lockdown and increasing infection amongst health workers and, of course, Nigerians. We're looking at it from 2 points of views, from the legal, the security, and the medical point of view. I have joining me from our Abuja studio the president of the Nigerian Medical Association, Dr. Famuyidele. He joins us from our Abuja studio. Thank you so much for joining us tonight. Let me start by asking you, are you perhaps worried when the federal government says it was going to ease the lockdown? Do you think it was early enough, or you think it was just okay?
Thank you very much. I must say that the Nigerian Medical Association came out powerfully to tell the whole nation that it was premature for us to have eased the lockdown at that time. And sincerely, the events that are happening have confirmed our fears that we are still having exponential increase in the cases of COVID-19 in this country, and we had insisted that that is not the right time to ease lockdown. I must say the increased numbers of positive cases in the last few days cannot be said to be related to easing the lockdown, because these are not yet fresh cases. These are not yet the cases that may have just been infected in just 3, 4, 5 days. We will see the main effect of this easing of lockdown in another 1 or 2 weeks. But it now shows us that while we were thinking things are going well, that a lot of Nigerians have been infected and community transmission has been going unfiltered within our communities generally in the country.
Dr. Fadwile, from what you're saying, it does look like what we're seeing in the past few days is not what has happened recently. It's perhaps what has happened in the last 2 or 3 weeks that we are seeing the result now. So the big question is that considering what we have seen in Ghana, we have seen in Germany, the United States is also saying, the government there is saying they want their people to, the economy to go back on stream. The federal government is saying people are not yielding to the guidelines that are being set, which of course, let me show you some of those guidelines and for Nigerians to see again what these guidelines look like. And the fear is that some of these guidelines have not been adhered to. So, Dr. Fadwile, what would be your advice right now if the federal government is saying, since people are not adhering to these guidelines, we might review it?
Well, if you want to look at it on face value, even when there was lockdown, the compliance was not that good. How much more do you expect people who were not following the guidelines during the time of lockdown to now change suddenly and start following the guidelines when they have allowed some easing of the lockdown? Importantly, people will have to move. They will have to take buses. They have to go to market. They have to go and apply their trades. And I can tell you what we have done will certainly, even the DG of the NCDC confessed on the first day that there will certainly be increase in the infection rate, seeing what happened on that first day. And I can tell you it's not going to be better, because people are not, they have not yet ingrained it in their subconsciousness that they needed to prevent themselves. And many of those regulations are not properly followed. We have a lot of places that you have people gathering together. You have a lot of crowd at a lot of areas. And the use of face masks, most of the time, face masks are used indiscriminately in such a way that it cannot actually protect them as it is expected. So we have a lot to do if we want to continue this pathway, but I can tell you this pathway may not give us the best way of resolving the transmission of COVID-19 within the country.
I will ask you this quick question before I bring another person on the program to join us and give us a perspective on security. As a professional body, the NMA, we are in a health emergency, Dr. Faduyele. Did the NMA give a professional opinion on how you hope that this health emergency should be handled? And now that the lockdown has been eased, have you given your opinion, professional opinion, on how you think the federal government, when you thought that they've not done the right thing?
Well, many times we give our own professional advice, and we have so far brought out three the policy statements. And but importantly, many of our members are part of those who are working with the different committees that have been established to see how they work on this lockdown, on this COVID-19 pandemic in Nigeria. But I must be quick to say that the Nigerian Medical Association also look beyond the pure scientific basis. We look at other issues that affect the welfare of the populace as well as welfare of our members. Unfortunately, we have not been able to get the best use of that opportunity. But even with that, we keep giving our professional views. We keep talking behind the scene with the committee members. We keep propping the government on doing the needful. However, the government is saddled with the duty of balancing all the issues together. And well, I am not the person who will make the final decision. But in this case, we have repeatedly stated that it is not when we are having increase in the number of infection that you want to ease any regulation in such a way to halt the transmission. Unfortunately, government decided to cave in on other areas because sincerely they knew that it was not good enough to ease the lockdown
Dr.
at that
Faduyele,
period.
yeah, let's get just a moment. I'll come to you to get some other views at issues relating to how health officials are now contacting these. This is a very worrying situation, and the issue of their margeries also. Let me get the view of Mr. A security consultant now who joins us, Mr. Kabir. Thank you so much for joining us tonight. Are you worried about the state of things in terms of the compliance level? And how do you make people comply with these guidelines in a civil environment that we have, that you don't now go against human rights of citizens?
In simple terms, it's about crisis communication. What kind of means do you communicate to people? What platform do you communicate to people? And then more importantly, how do you engage with them?
Getting the audio from Mr. Kabir there. But if you can hear me, maybe we can give it another try. I'm wondering how easy for the federal government, who gave the guidelines on what to do at the ease of the lockdown, and now so people's rights are not violated in these, how easy it is to implement these guidelines.
If you can hear me, I was saying it's about crisis communication. We communicate to different members of the society. Of course, there are different groups, there are different levels of education, and then, of course, different interpretations to these guidelines. So how do we make sure people understand that this policy is for their own protection? Currently, I'm not seeing enough of that type of communication. Then on the other hand, the guidelines that have been given to the security agencies, they are interpreting it differently Just yesterday, we saw at the PTF COVID-19, the briefing they did, where someone asked a question regarding medical workers and the press, and how the coordinator himself was surprised that the security agencies did not understand the directive that was given, that there were exceptions. So I think it's a whole lot of things that have to do with crisis communication, which unfortunately I don't think we're handling very well at the moment.
Stay with us, Mr. Adamu. We go on a short break, and when we come back, there are more concerns. If the federal government thinks that things are not going the way they wanted to go, what are the fears and the implications? We come back and talk more with my guests on the program. Don't go away. We'll be right back. Thank you so much, everyone, for staying with us on the program. We're assessing the ease of lockdown after the federal government relieved the process in Lagos, Ogun State, and the FCT. My guest tonight, Dr. Francis Faduile, is the president of the Nigerian Medical Association and the security consultant, Mr. Aliyu Adamu. Thank you so much, gentlemen, for coming on tonight. Let me come back quickly to you, Mr. Adamu. The federal government, in this sense, will say, we've done our part. The citizens, on their own, are supposed to do their part in ensuring that these guidelines, they stop the spread from their own point of view. The federal government is to administer the test, is to help administer the isolation and the treatment. But the part that concerns the citizen, what do you think makes it difficult? Dr. Faduile said, look, it was difficult for Nigerians to even obey the lockdown, not to talk of when it was eased. Why could it be so difficult to obey the guidelines?
In the first instance, it's a well-established fact. Unfortunately, there is a trust deficit between government and the citizens. And this trust deficit has grown over time for a lot of reasons. Our history is responsible for it, the economic hardship, corruption, so many reasons have been alluded for the trust deficit. Then on the other hand, you also have this high level of illiteracy that is quite common in a lot of areas. Now, why is illiteracy a factor? The language that we're using currently to communicate and the means that we're using currently to communicate, frankly, is a bit elitist. And the majority of Nigerians, probably about 70% of Nigerians, fall within that category where they need a different means of communication. Then, on the other hand, and we need to speak about this, the National Human Rights Commission, in the report they released last month, as well as the CLEAN, which is an NGO, documented what they call sharp practices and extortion by security agencies. So the fact that I know if I do come out, against the government guidelines and I give some form of money, then security agencies may allow me to pass. It's also a factor. If I know that whatever I give them, irrespective of how enticing it is, they are not going to collect it and they will make me go back, then I'm not likely to venture to come out, because it's a game between me giving probably 100 naira and then picking 5 passengers and making 1,000 naira from those 5 passengers. So I've made probably 900 naira. So there are a multitude of factors that have led to where we are at the moment, unfortunately.
Let me go to Dr. Faduile. A lot of people say, look, what Nigeria has capacity to do right now is to prevent and curtail the spread. That we might not be able to accommodate or to go into a full-scale case on our hands like we find in Europe and in America, God forbid. What would you advise as a professional body at this stage when the federal government realized that these ease of lockdown and the guidelines are not being adhered to? Would you say that a total lockdown should be imposed immediately?
Well, what is desirable is for us to have a total lockdown. However, it is difficult to observe total lockdown without having the increment in the testing capacity to go hand in hand. If we lock down and we don't do a high number of testing, the lockdown may not be that effective. And the reason is the purpose of the lockdown is to stall everybody so that we don't have further transmission of those who are infected to others who are non-infected. But if you don't have this massive testing in such a way that we can identify those who are positive, take them out of the community so that they do not infect others, and break that route of infection. Sincerely, if we lock down between now and next 2 years, we may not get the desirable outcome. So we don't lock down for lockdown's sake. We must lock down and then increase the number of testing of patients, and also to follow up all cases so that we can track all those who are positive. But to do this, I think the government is becoming overwhelmed, and that is very grievous at this time. I have stated it that the two epicenters that is evolving now are the two most populous states in this country, Lagos State and Kano State. And I think it calls for concern, because if we cannot control this spread within the community in these two states, we'll have a very, very big problem in our hands. And we should not be unmindful that all preparations that we have had, either in the total number of bed space in our isolation or treatment centers, as well as some of our hospitals that are being dedicated to treat some of those who have been infected, I can tell you we may not be able to have enough capacity to hold them. And we may be forced to have people taking care of themselves at different homes. And in that respect, it is a circadian rhythm that it is very difficult for us to be able to break that.
So, Dr. Fadile, before we get this, perhaps is going to be like your closing thought before I go to Mr. Adamu also to give us his closing thought on the program tonight. And I'd like you to touch on two issues and put them together just in about 60 seconds. The first one has to do with some of your members, health officials, increasingly every day. Yesterday, we got about almost 20 nurses who are positive to COVID-19. More of your members and health workers are being infected with the disease. And of course, several of the Amajiri children are also dying and contracting this disease. Are you worried about this state of things?
We are really worried. First, I think it is wrong at this time for us to be transporting the Almajiri off wherever they are. It is a way of spreading the virus, and I think it should be halted. Secondly, we have been talking about the provision of PPE for our members, and also to ensure that all our members who are treating patients at this time needs to be properly trained. The training we are talking about is not about their clinical acumen. It's about training protocol in infection prevention control. We need that training so that we can use the PPE appropriately, we can dispose it off appropriately, and we know how to interact with patients appropriately. These are things that are needed at this time so that we can stall this infection amongst health professionals. But the major problem we must have at the back of our hand is that Nigeria is perennially having shortage of health professionals, and the more that are infected and taken off circulation, the more acute the problem of having very low number of health professionals.
Dr. Fadile, apologies to
that are now.
So apologies to, I wanted you to specifically speak on some of the health workers affected in Kano, and what is the number of those affected in Kano State and in Nigeria? Do you have the number of your health workers that are affected, and what can be done to this situation? Just in about 30 seconds, Dr. Fadile.
Well, I think we have over 150 of health workers who are affected recently. In one department in Kano, about 20 doctors were affected and some commensurate number of nurses. Totally, after testing the teaching hospital, they have up to 30 doctors that are affected. And Kano State does not have that leverage of having that large number of doctors. For example, in Zamfara State, the state government has about 29 doctors. By the time you have 5 or 10 of them, are coming down with COVID-19, you know they will have crisis. So what we are saying is get PPE for them, train them properly so that we can give the best treatment for our patients.
Thank you, Dr. Faduyile. So let me give Mr. Adamu this final shot. There are a lot of divergent opinions, especially from religious leaders, on what to do and their beliefs on what not. From going forward from here, just in 30 seconds, where do we go from here? The fears that you have.
Accept the fact that this and it doesn't kill just the rich people. It kills everyone. So religious leaders, traditional rulers, everyone. I think our engagement strategy, we need to change it from government down to everyone. Change the engagement strategy, change the communication, or expand rather the communication methods so that everyone in society is reached and people now take this disease seriously.
Mr. Adamu, thank you so much. And Dr. Faduyile, thank you for your time. And that's our program tonight. Thank you so much, everyone, for watching. I'm Sean Akimale. Bye-bye.